Welcome back to Winging It Buffalo Style. May is National Arthritis Awareness Month, so today in our health segment, we're delving into the details of this disease that affects more than 2.1 million Americans. We're joined on the couch right now by Dr. Robert E. Capro, founder of the Rheumatology Consultants of Western New York, to discuss rheumatoid arthritis specifically. And right away, we just want to mention that we have another Buffalo connection happening in the studio. You are a big fan of Chef Orazio over there.
I am. For the last couple of years, we've had our annual office dinner at Orazio's, and we're planning on doing it again next year.
All right, you better get cooking. No pressure, Chef Orazio, for the fine folks of the Rheumatoid Arthritis Consultants of Western New York. But as we're thinking about Arthritis Awareness Month, your specialty is treating people with rheumatoid arthritis and with lupus. Tell us a little bit about each of these conditions.
Well, both of these are called autoimmune diseases, in which the body has a defense system, the immune system, that's very important in being able to fight off infections. This system sometimes becomes dysfunctional and attacks itself. In rheumatoid arthritis, it primarily affects the lining tissue of joints, causing pain, swelling of the joints, typically in a symmetric fashion, usually involving the hands and feet, but many other joints as well. And fatigue is a major factor. Having inflammation in the body is like having the flu. With lupus, the body attacks itself and can attack many different organ systems, including the joints, skin, kidneys, hearts, lungs, the blood system, so that lupus is often a great imitator in that it mimics other diseases. But they are related in the fact that an inflammatory arthritis affects both, and so people lose energy, have painful swollen joints, have prolonged morning stiffness.
And what ages are we talking for each of these diseases? What ages do they mostly affect?
Lupus is primarily a disease of young women, occurring 20 to 40, but over the passage of time, we've learned that it can affect people of almost any age. And rheumatoid arthritis primarily affects, again, more women than men, with 30 to 60 years as the primary age group, but all ages, including children.
And since it is Rheumatoid Arthritis and Lupus Awareness Month, just what would you like people at home to be aware of when it comes to how you treat each of these diseases?
Well, now, for both diseases, making the diagnosis is key. And over the years, improvements in our treatment have been great. In the old days, people with rheumatoid arthritis often went on to joint deformity, joint damage, and disability, and this occurs much less often now because of the progress we've made in treatment. So if you have pain in the joints, swelling in the joints, stiffness, go see your doctor.
Okay, and how can people find your practice, and where are you located?
We are Rheumatology Consultants of Western New York. We're in West Seneca on Seneca Street. Our website is rheumatologyconsultantswny.com, and we see patients. We're accepting new patients. We see patients on referral from their primary care physicians, and we'll see people who, if they're able to, call us on their own.
All right, Dr. Capro, thanks so much for shedding the light a little bit on each of these diseases. And on this Memorial Day, also thank you for your service to our country as well. We appreciate it.
Thank you very much.